Let's go!
Hey y'all, welcome back to my channel. It has been a very long time and I am so sorry that I have abandoned you all with my vlogging. But life has been lifing and medical school is very demanding, so I am so sorry that I have not been able to post as much as I originally planned, but we're back. I have some time and a lot of you have been reaching out asking about away rotations, should you do them, and what my experience was like doing my away rotations. So I'm going to jump right in and give you all my thoughts and my suggestions and hopefully answer some of the questions that you have about doing away rotations or sub-internships, whatever you want to call them. So the first question is, should you do them? I think you really need to think about, number one, what specialty you're going into and if it's typically required for that particular specialty when you're applying for residency. So traditionally there's some specialties, especially the more competitive ones, that will require these sub-Is or these externships, or they will be more beneficial for you to do them. Typically this is like orthopedic surgery, general surgery, OBGYN, neurosurgery, etc. Some people do it for neurology, I believe. And so depending on what specialty you go into, you might want or might need to do these sub-internships. Again, you also want to think about why you want to do them as well, and like what are you trying to get out of them. So some people will do it to round out their application. As an example, at Florida State University, we're a very primary care heavy school or focused school. And so we don't have a very robust surgical department and we don't have really any exposure to surgical residents. So for me, it was really important because I wanted to show that I could function within the surgical team. I knew how to interact with interns, fellows, attendings in this more like hierarchical environment in certain cases, and just simply knew how to help interns and work on the team. And so some people will do this to round out their application in that sense. Other people will do it for personal interest, so wanting to see if they prefer an academic versus community environment. And what do I mean by this? So Florida State, for example, is primarily a more community environment. We rotate at community hospitals, which are smaller, have little to no residents. We work one-on-one with attendings. So every day when I was on my surgery rotation, it was just me and the attending. I was first assist on all the surgeries, which is awesome. Like I knew very well how to conduct myself in the OR, knew how to first assist very competently as I was going into these sub-internships. But it could also be kind of intimidating, or coming from that environment, going into a very hierarchical environment where you answer to the intern, who answers to the mid-level, who answers to the fellow, who answers to the attending. And so since I was not in that environment as a medical student, kind of had to prepare myself mentally for being in that environment in the academic setting, and I felt even more inclined to do my away rotations at these like very large academic centers that had lots of residents, had very complex procedures or complex subspecialties, because I didn't have this exposure when I was in medical school. And so being somebody that is pursuing general surgery, it's easy to love surgery when you're not working a demanding schedule, when you're working one-on-one with an attending, when you're first assist on all the procedures. Residency doesn't look like that. And so for me, one of the things that I wanted to do was to put myself in that environment, especially for general surgery, and really know if this is something that I would enjoy for the next 5 years of my life, right? Because my attending, who is 60 years old and coming towards the end of his practice, has a very different environment than my first year of residency. So I really wanted to get that exposure. Other people will do these sub-internships to get some exposure to a specific institution or to get some exposure to a specific region. So sometimes it can be difficult when you're applying to residency to get interviews outside of the region that you're in. So for example, I'm in the Southeast region And if I wanted to go to the West Coast for residency, then it would be in my best interest to do a sub-internship on the West Coast, or at least try to, and show on my application when I apply to residency that I actually went to the West Coast to do a sub-internship because I was that interested in that location or pursuing a career in that location. So actually some of my classmates went ahead and did that, and it's also tends to be very helpful when it comes to, again, getting interviews. They'll see that you have that experience and it makes it look more promising that you would go there if you were offered an interview. If you really wanted to go to a specific place but you weren't sure if you liked it or not, that would be the perfect way to get some exposure, or to get like letters of recs from a specific academic institution. So again, FSU does not have a large surgical department, and so a lot of the faculty that are in surgery are not known nationwide. And so when I was doing my away rotations, my goal was to get a letter of recommendation from a faculty member at one of these institutions that were, you know, really well known nationwide. And so that would really add to my application when I was applying to residency. It would not only help coming from Florida State, which is a very primary care heavy school and not really robust in surgery, it helps to have that kind of advocacy from somebody that is in the fields, very heavily involved in the fields, and has worked with me. And so that's another kind of reason why you would do an away rotation. Now, it doesn't mean that you're gonna go to do an away rotation and guarantee yourself a letter, and a good letter, but these are some of the reasons why people do these away rotations. The next question is, how many away rotations should you do? First, it really depends on how much your school is gonna allow you to do. It also really depends how much experience is available at your school already. So if you have a school that has a really robust surgical department and has a really robust surgical experience with residents and subspecialties and whatnot, then you might not need to go to other institutions for that experience. You might just go to another institution to get specific exposure to that institution and to foster those relationships. But to get an experience specifically in surgery because it's not offered at your school, that would be more unlikely. So I ended up doing 3 because that was the max that we were allowed to do, and I enjoyed surgery and I kind of wanted to get that exposure at different places. When you're applying to these away rotations, just because you apply to 3 of them off the bat doesn't mean you're gonna get all 3. And it actually seems pretty competitive to get these away rotations depending on what institutions you're trying to go to. The large academic institutions, especially like the Ivy Leagues, are much more competitive to get into. If that's what you're looking for, just be prepared that it's going to be challenging, and be honest with the application that you're coming forth with. Okay, so how do you apply for these away rotations? Basically, applying to these away rotations is like a mini residency application. It's also offered through the AAMC website on a portal called VSLO, which stands for Visiting Student Learning Opportunities. Most of the institutions that you will be applying to actually uses this portal. There's a few places that might not use it. So depending on what institution you want to go to, you would go to their website and see if they utilize VSLO or not, or see what their requirements are for applying for these OA rotations. Now, if you use VSLO, I'm going to tell you what things that they require. So basically the application has several parts. It's going to ask for your personal information. It's going to ask for your academic information, so like what institution you're at. Then you have the option to add electives. So you'll have all the institutions listed, and then each institution will have their specific specialties, and then they'll have subspecialty electives, and you can choose the elective you want to do and the dates. So depending on the institution, they'll have specific requirements, but most of them have the same things, which is like your immunization form. So you have to be up to date on all your vaccinations. They're gonna ask for a CV, which you should have an updated one. They're gonna ask for a picture, like a headshot. They'll ask for your step scores. They'll also ask for your transcript to be uploaded by your institution. And then some programs will request a letter of recommendation. I didn't see that for most programs, but there were some, so just keep that in mind. And then you'll be asked to rank in order of preference of the electives that you want to do at a specific institution. So for example, let's say you're applying to X university and you really wanted to do trauma surgery and you wanted to maximize the chances of doing a surgical rotation there. You would essentially apply to all the surgical subspecialties, but since you really want to do trauma surgery, you would probably rank that the highest. If you really want to do trauma surgery in early June, then you would put those dates ranked number 1. So basically, the more rotation electives that you apply for and the more dates you include, the more expensive it is, but the more you maximize your chances of getting a spot at that institution. It can be pretty expensive. I would say every application that you submit is about $15, which tends to add up very quickly. So just keep that in mind. The annoying part is that all the institutions make their offers at different times. So you might accept an offer at a place that you want to go to, and then you might get 2 other offers, and then you might have to choose which institution from those other 2 that you're going to go to. Not all of them offer scholarships. That's something that you need to apply to separately, and it's a completely separate application. So if you do want to cut costs at the institutions, they do offer scholarships, especially for underrepresented in medicine students or minority students. And so I would highly recommend you take advantage of this. This is something I took advantage of, and they basically offer like anywhere from $1,000 to $2,000 to help either travel or housing costs. My other suggestion is wherever you do an away rotation, try to do it at a place where you know where people live, where you can get either free housing or you can get cheaper housing. So when I was rotating at the University of Miami, I stayed with my parents because they're from Miami. And then when I went to Wake Forest, I actually stayed with an FSU alum that rented a room to me for $400, which was awesome. When I went to Emory in Atlanta, I actually stayed with my sorority sister. I stayed on her couch and I sent her money for utilities. That's kind of how that worked out. Obviously, a lot cheaper than if I would have been getting an Airbnb or hotel for that whole time. And also if I didn't take my car. I took my car to all these places. And then I had gotten a scholarship at Wake Forest, which was about $2,000. Helped tremendously. When you're applying to these away rotations, try to limit the costs that you accrue, because you don't want to be taking out these excessive amount of loans or racking up your credit cards to get these experiences. There is still a huge controversy whether doing these away rotations are beneficial or not. Some people say that they might hurt you because they are month-long interviews and they are pretty exhausting, and you're always having to perform at your best every single day, which is literally not human. So keep in mind that you have to do really well in these rotations, and you have to keep this etiquette with these institutions, because at the end of the day, you're going to be applying to them for residency. So every interaction you have with their clinical coordinators in your application process or your onboarding process, or in person if you end up going on an away rotation, is going to reflect yourself and determine whether or not you're going to get an interview at these places. So just keep that in mind. So again, just recapping, should you do an away rotation? Why should you do it? What are you trying to get out of it? Are you trying to get a letter of rec? Are you trying to see a geographic location? Are you trying to break out of the region for when you're applying to residency? Are you interested in exploring a specific program, etc.? So now let's say that you're applying to these away rotations, you're getting them lined up with your schedule, you got confirmations from these institutions. Here are some tips on how to be successful, because not all the institutions function in the same way. Some will be more responsive than others. Some will require more follow-up than others. So just make sure you're following up with the clinical coordinator. Make sure you have all your paperwork ready to go. The onboarding process can be very tedious, so just make sure you knock it out as early as possible. Make sure you ask, where do you need to show up on the first day? What do you need to bring with you? What are the expectations? When you're on the actual rotation, in order to be successful, communicate very clearly with your intern. That's probably who you're going to be working with the most. You want to be there before them and you want to leave after them, or, be dismissed accordingly. But you're gonna expect to be there very early and end up leaving pretty late. So especially depending on the rotation that you're on for surgery, I was anywhere starting at like 5 in the morning and leaving at like 6 to 7 p.m. depending on the institution. So just be aware of that. It's going to be pretty exhausting. Make sure you're reviewing your cases ahead of time. If there's a specific topic or specific pathology that is coming up in terms of a patient, you want to make sure that you're prepared to talk about it if you're asked questions about it. Don't forget your goal in doing that away rotation. If you were there to get a letter of rec, make sure you're reaching out to the people that you need to reach out ahead of time. If you're there to meet the program director or to meet the chair of surgery, make sure you email ahead of time and try to set up those meetings before you even go to the rotation. Like, introduce yourself, be very professional in all your email interactions, because people will take note of all those things. This is definitely something you want to be on top of. If people aren't being responsive via email, try to see if you can locate their office, see if you could visit in person while you're there. These are all things that show that you're very proactive, very interested, but don't be weird about it either. Also, make the effort to connect with residents. If residents are having events outside of the hospital, try to go to those as well, because you'll be able to better see how residents interact with each other, not only in the clinical setting, but outside of the clinical setting. These are going to be people that you're going to spend, if you apply to residency there, you're going to spend like more time with them than you are with your family. So you want to make sure there's people that you jive with or people that are happy in that hospital. And then you always want to make sure that you're reaching out to alumni from your own institution or friends that you know at that institution and getting tips from them before you even go there. Learn a little bit more about their experience, so you might be more interested in the program or less interested in the program. You only get a certain amount of away rotations, so you want to make sure you're choosing wisely and making most of your time, especially because away rotations are very exhausting. Now let's say you wrapped up away rotations, you're coming towards the end, what now? Before you leave that institution, make sure you get your evals done in a timely manner. You don't want to leave an institution and have to reach back out, because that's a huge pain in the butt. I experienced it myself. It's just a lot easier if you get your evaluations done before you leave that institution, especially if you're doing away rotations back to back. And then make sure you follow up with the institution, especially if that's a place you really want to go. And then when you're on the interview trail, they're going to have access to your transcript, and a lot of times it'll list what institution you were at or what rotation you did. And if it's brought up on the interview trail, make sure you highlight, what you gained from the experience, and always tie it back to how that's going to make you a better resident and how that's why you're very interested in their program, because you saw that they had similar experiences or things that you enjoyed. Always tie it back to that institution and why that makes you a better resident and why you're very interested in their program, because it has X, Y, and Z, which you really learn to appreciate from your other experiences at these other institutions, etc. Or if you're interviewing at an institution where you did an away rotation there, make sure you're emphasizing it. And then always emphasize it on your follow-ups with that institution. So with your interviewers, when you're sending them thank you cards, reiterate, I was a sub-I there, I really enjoyed the experience, blah, 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 blah. So that's pretty much it that I could think of off the top of my head. I hope I answered your questions. I hope this was helpful. If you have any specific questions or anything that I did not cover, you can always reach out. I am always available to chat. And yeah, wishing you all the best of luck. Enjoy fourth year, work hard, and remember, it's temporary. It's all gonna work out in the end, so just trust the process. Bye.
1, 2, 3, let's go.